Then the next time, when you get pregnant, as you get heavier and heavier and heavier, just at least get wedges, those big heels that have a big support, so that they can accommodate. Because when the body increases in size, the lines of gravity acting on you are many. And these muscles of ours, especially the stomach muscles and the back muscles, are there to control this force of gravity that is acting on us. So I now imagine the stability is only a nail. How is it going to sustain this big weight that is you're adding on during these weeks of pregnancy?
Yeah. How do you think we can avoid this kind of pain?
If you had previous pains during pregnancy, it is very possible, it is very vivid for you to have this pain after giving birth. That one is. And then there are some people, if they have well managed themselves, they have taken the right care, being so observant of what they are supposed to do as they are pregnant. Some may experience it after giving birth. So now, these ones who experience this after giving birth, some mothers, now imagine, some of those ones who give birth normally, without, vaginal birth, which is normal delivery, they feel like, I didn't do a lot of things, my body is okay, they didn't cut me. So they'd be like, I'm going to return back to my chores, I'm going to go back, wash my clothes, do everything, cook for myself, walk around. By the time, remember, this body has been experiencing these changes in the body. Now, by the time they come after giving birth, and then they go back to these chores without even educating, because when we give birth, these muscles swell up, and they loosen up their air. So what happens is when they are weak, they need to be exercised and strengthened before you go back to the chores you used to do. Now that is the mistake mothers do after giving birth. Then they get this pain. If you did not get it during pregnancy, some may get it after. And when they do these chores very fast. So if they really do these things casually, what you do, exercise the muscles, make them stronger, and also visit the doctors at least to update you, to keep you on checks, to know where you've reached with your body and status.
We bring to you a very interesting topic about management of lower and upper back pain, most especially in the postnatal mothers. These are mothers who have just given birth. With us is a very passionate health worker who is so interested in these mothers, who has walked a journey with them, who could take us through what has caused this pain, what usually causes this pain, how we can avoid it, and how we can manage it. Most mothers think this pain is actually normal, and they don't even care about how they can look after themselves and how they can manage it. But here we are today to tell you this pain is actually manageable. With us is Sharon, a physiotherapist, and she'll be taking us through about how we can go about this pain. Sharon, you're welcome.
Thank you, Shivan, for inviting me. I'm Nakate Sharon. I'm a physiotherapist. I've had a good experience with these mothers, and most of them have come with this lower back pain, and most of them go out of the clinic improved after a while of treatment. So thank you so much for inviting me to enlighten them more.
Sharon, a physiotherapist who is with us today, has walked a journey with several mothers who have had these kinds of pain, this kind of back pain, but Aunt has to take us deeper this time into what back pain is all about, what this pain is all about, how we can manage it. Sharon, what exactly is this back pain about?
So first of all, what we have to understand is, what is the back?
Yes,
we need to understand that before we go to the pain itself. So the back is composed of three parts. We have the cervical region, which is the neck region, the thoracic, which you normally refer to as the upper back pain, upper back, and then the lower back. Those are the three parts of the back. Though today we are going to talk more about the lower back pain. So any discomfort that you feel along that back, whether the upper or the lower, it is all back pain. Yes.
So is the lower back pain the one usually associated with the mothers after giving birth, or why do you want to dig deep into only about lower back pain? Is it?
all these regions affect the mother after giving birth.
Okay.
But the most one that mothers complain about, especially during the first weeks or even the first months after giving birth, it is the lower back pain. Though at times, sometimes the upper back pain too.
Okay. So what exactly causes this kind of back pain? What is it supposed to be there? What exactly causes it?
Okay, so this back pain, first of all, it begins all the way from pregnancy.
Okay.
Yeah, so because with this, when the body, when you're preparing, like the body is preparing to have this baby, it is put together by different hormones, physical changes that come about.
Okay.
So all these contribute. So as the hormones come to play, they tend to weaken the ligaments where these muscles and bones are connected to. And so that is how some of this pain comes, because of the strain on the back.
Aren't you about to scare some of us who intend to get pregnant and give birth?
Not really. Actually, this is good to know information so that you can get to know it. By the time you give birth, you know what to do and what not to do. Because some of this back pain, actually, yes, as long as we call it discomfort, some can tend to be much and tends to be severe. And if it's not managed, it can become chronic. So you understand the stage from discomfort to severe to chronic. So before you go to the severe and the chronic, at least you're able to know.
Okay. So is this back pain like a must for every mother, or you know that you're a mother too? Do you have like life experiences about this back pain? Like, is it a must for every mother to experience it?
I wouldn't say it is a must, but the truth to be told is discomfort in the back is like a must to a mother. But when the discomfort stays for a long time, it becomes pain.
Okay.
And then it goes to that severity and whatever that I explained to you about. So anytime, anywhere, this back pain, somewhere the discomfort is expected. But the pain is what we want us to avoid. Because now in the society that we are in, people tend to feel like it is normal to have back pain. But if we do the things that we're going to talk about like ahead, you get to understand that actually we are not supposed to have with the pain during pregnancy or even after. Yes.
Okay, this whole pregnancy thing, you guys, every pain during pregnancy. Won't we fear giving birth because of this pain here and there, pain in the legs, pain in the back? Won't some of us fear giving birth because of this pregnancy pain? Like, okay, is it a must for every pregnant person to get this kind of pain, or it's only for
by the way, that's why actually I thank such spaces, because they are here to enlighten us, to actually help these upcoming mothers to avoid such pains. At least stop on the discomfort and don't go crossover to the pain, to the severe and even chronic pain. Yeah.
Okay. So you told us you are a mother too. Kindly tell us, do you have like any life experiences about this kind of pain? What you could think have caused it to you, and maybe how you think we can manage it?
Yeah. So first of all, with me, despite the fact that I had gone at school to study physiotherapy, I knew about how these things come about and whatever. But as a mother, first-time mother, there is a way society comes in to give you lectures about things. You'll be like, no, as a mother, this is what you're supposed to do. Do not oversee it. Keep moving around. Do some chores. Don't be lazy. But I realize some of these chores that they force these mothers to do, it actually contributes to the back pain. Because some people feel like our mothers back then, they'll be like, for us, we used to dig, we used to wash, we used to cook, we used to do a lot of chores, and we could just wait for the day to push the baby and the baby's out. But some of those things do not apply, because you find from the studies that are being done that overworking, actually overbending during pregnancy, carrying heavy things. Now imagine digging for way back. Sometime back, digging requires you to keep bending all the time. It pre-exposes you to this back pain. Okay? Carrying heavy loads. Those women used to carry firewood and whatever. Those things were heavy. And it was contributing. It contributes actually to the back pain. So me, as experience that I got was, society was telling me another thing, that if you don't do this, you're becoming a lazy wife, you're becoming a lazy mother. You mothers of these days, But I realized it caused me pain with my first child because I have 3 children.
Okay.
But when I did the right thing of giving myself rest, having the right postures, it helped me a lot. And I didn't experience this back pain in my preceding 2 pregnancies.
Okay. So it's actually new. It's actually the first time I'm hearing that a pregnant mother should rest. I think
Yeah.
society has really spoiled my mind to
Yes.
thinking that pregnant mothers need to work themselves out.
Actually, not resting per se, doing the right thing
Okay.
is what matters. For example, because among the things that we do to help to reduce this discomfort that can result into pain is actually exercising.
Okay.
We don't need to be in one place sitting for long. Now it's the challenge that we have nowadays.
True.
Those days we used to have digging. Digging is reduced these days. But now we have people who work a lot. Working mothers. You sit in the office 2 hours without even getting up.
True.
That is predisposing you to this back pain.
Okay.
Yes. Also, like overstanding, some of our works tend to predispose us to that.
Yeah, true.
Some mothers put on heels during pregnancy. All those ones are contributing to your pain that even will carry on even after giving birth.
Some of us are heel babies. We want to put on heels. What do you...
So now, during pregnancy, at least the base of support has to increase a bit. If you've been putting on this canal heel, then the next time when you get pregnant, as you get heavier and heavier and heavier, just at least get wedges, those big heels that have a big support so that they can accommodate, because when the body increases in size, the lines of gravity acting on you are many.
Okay.
And these muscles of ours, especially the stomach muscles and the back muscles, are there to control this force of gravity that is acting on us. So now imagine the stability is only a nail. How is it going to sustain this big weight that is you're adding on during these weeks of pregnancy? Yeah.
So Sharon, how do you think we can, okay, from your experiences now, how do you think our mothers who are maybe watching or who could need this can avoid this kind of pain? Because not everyone has done physiotherapy. Most of us actually need this kind of education. How do you think we can avoid this kind of pain?
Yeah, so first of all, this pain, when it's not managed well in pregnancy, it can carry on after giving birth. Now, during birth, if you had previous pains during pregnancy, it is very possible, it is very vivid for you to have this pain after giving birth.
Okay.
That one is. And then there are some people, if they have well managed themselves, they have taken the right care, being so observant of what they are supposed to do as they are pregnant. Some may experience it after giving birth. So now, these ones who experience this after giving birth, some mothers, now imagine, some of those ones who give birth normally, without, vaginal birth, which is normal delivery, they feel like, I didn't do a lot of things, my body is okay, they didn't cut me, so they'd be like, I'm going to return back to my chores, I'm going to go back, wash my clothes, do everything, cook for myself, mop around. By the time remember, this body has been experiencing these changes in the body.
Yeah, true.
Now, by the time they come after giving birth, and then they go back to these chores without even educating, because when we give birth, these muscles swell up and they loosen up their So what happens is, when they are weak, they need to be exercised and strengthened before you go back to the chores you used to do. Now, that is the mistake mothers do after giving birth. Then they get this pain. If you did not get it during pregnancy, some may get it after. And when they do these chores very fast. So, if they really do these things casually, what you do, exercise the muscles, make them stronger, and also visit the doctors at least to update you, to keep you on checks, to know where you've reached with your body.
So what kind of exercises are we supposed to do during pregnancy that will actually help minimize the chances of getting this postnatal pain?
So first of all, walking around, especially the first weeks. You don't need to, yes, the sleep can be much when you've given birth, because you've spent some good months without sleeping because of the
I know.
discomfort and whatever and the heaviness.
Mm.
So what happens? You have to limit your sleep time as much as possible, especially when you can sleep, but what I'm saying, when you're up, at least walk about. Walking about, not doing chores that predispose you to the challenges. Just walking around in the compound, even if you make reps of 5, 10.
Okay.
First of all, you're engaging these muscles that have been elastic for a long time as they are accommodating this pregnancy. Then usually after 3 weeks, when you're kind of getting back, these muscles are getting engaged, then there are some simple exercises that you can begin.